Hello, my name is Joyce Dilliman. I'm an occupational therapist here at Meadville Medical Center, and I'm here to give you some information that you're going to need as you're preparing for your total knee arthroplasty. The things we're going to talk about today are what you'll need to bring to the hospital, what you're going to expect while you're here at the hospital, and the rules for the first 2 weeks following your surgery while you're recuperating at home. Please keep in mind that all of the instructions that I'm giving you at this time are general, and if you have any special circumstances or considerations that need to be brought to your surgeon's attention, you'll need to discuss that with him after this video. When you're packing for your stay at the hospital, you will need to definitely bring your knee immobilizers. You have to have those during your stay. Do not forget them. You will not need to bring any other equipment that you may have been gathering or getting in preparation for the surgery. You will use our canes, our walkers, our dressing equipment while you're staying in the hospital. Please leave yours at home. If you need to have your walker or cane to get into the hospital, certainly use it, but then have your family or friends take it back to the car so that it doesn't get lost during your surgical time. As far as clothes go, whatever undergarments you would normally wear to be comfortable, bring those. We do prefer that you wear loose-fitting clothing. Elastic waistbands are generally more comfortable. You will probably put on at least 10 pounds, sometimes more, of fluid weight throughout the process of the surgery. The weight will come back off, but your clothes will be tight in the meantime. So loose-fitting clothing, elastic waistbands are best. Shorts are generally easier for us to get access to your knee so we can check your incision. However, if you want to wear pants, you may do so. Just make sure that they are cotton pants or that they have wide enough legs that we could roll them the whole way up to your thigh. For your top half, anything that you're comfortable in would be fine. Short sleeves, long sleeves. Some people prefer to bring both because you may find you're a little bit cold until you get started moving in your therapies, and then you need to take some layers off. We do also want you to have regular shoes to wear, something with a nice non-skid sole, and preferably something that goes around the back of your heel so you're not shuffling along trying to keep your feet shoved into your shoe. That's pretty much it as far as clothing goes. You may also want to bring some of your own toiletries. We certainly have toiletries here at the hospital for you to use, but if there's something in particular that you prefer to have, you can bring that with you. Now, you'll call the hospital the day before your surgery, and they'll tell you what time you need to arrive and also give you directions as to where you need to go. Following your surgery, you'll be transferred to the 4th floor at the Liberty Street facility, and once you're up on the 4th floor, nursing will assist you with bathing and also your medications. The doctors and surgeons will come in to see you, and physical therapy may or may not see you that first day of your surgery. Depends on what time you're done with your surgery and how you're doing. The day after your surgery, physical therapy will be coming into the room to help you do some stretching and go for a short walk. Occupational therapy will also be coming into your room, will help you with getting dressed and get your knee immobilizer on in preparation for your transfer to the Grove Street facility. When you're transferred to Grove Street, you'll come to the 3rd floor to the rehabilitation unit. And once you're there, the nurses again will assist you with bathing and also with giving you your medications. And physical therapy will see you that first day at Grove Street here in the afternoon. The next morning, occupational therapy will come in again to assist you with getting dressed. We'll show you how to use the adaptive equipment for getting yourself dressed independently, so you'll be able to do that at home. We'll also work on getting in and out of the bed using the cane as a leg lifter and talk to you more about correct positioning while you're recuperating. Social work will see you as well at Grove Street facility, and they will help you to get any of the equipment that you might need to get for the time that you're recuperating as well. The doctor and the surgeon will also see you at Grove Street as they did at Liberty Street. You will be getting 2 sessions of physical therapy a day and 2 sessions of occupational therapy a day while you're staying at the Grove Street facility. Physical therapy will assist you again with walking with the walker. They'll make sure that you're able to navigate on the stairs safely, make sure you're able to get in and out of the bed safely, and they will be working on your stretches. Our goal for the first 2 weeks is to get 0 to 90 degrees. We're talking about 0 degrees as full extension with your knee perfectly straight, and 90 degrees is the amount of bend that you'll need to have. And they'll show you some stretches to do to help you attain those numbers. Occupational therapy, again, will show you how to get dressed. We'll show you how to get in and out of the bathtub or the shower safely. Make sure that you're able to get up and down from the chair, from the toilet, from the bed, and make sure that you're able to get in and out of the car safely. I would also recommend, if it is at all possible, for a family member or a friend or somebody that's going to be assisting with your care upon your discharge to come to your therapy sessions, that they do so. You will find that you're going to be medicated for your pain control, and it's nice to have a second set of ears there, especially if it's somebody who's going to be assisting you when you're home, so that they know as well as you know what you're to be doing after your discharge from the hospital. If it is not possible for them to do that, if they could at least, when they come in for the nurse's discharge, let one of the therapists know, and we can certainly come and see them. Often people do leave that second day after surgery. However, if you're not feeling well, if you're not moving well, if for some reason we do not think that will be safe, you will not be going home that day. We will not send you home until we're sure that you're safe to go home. So you may want to pack an extra couple of pairs of clothes just in case your stay ends up being a little bit longer than you anticipated. You'll need to use a walker every single time you walk for the first 2 weeks at least. The doctor will tell you when you are able to stop using the walker. The walker you're using should be what we call a standard walker, which means there are no wheels on this thing. Please do not use a wheeled walker unless a physical therapist has assessed how you're moving in one and says that that's okay. If the walker that you've gotten or the walker that you have has wheels, you need to let us know so that we can get the standard legs to put onto the walker. But you need to make sure you have a walker, and if you don't, we'll make sure we get one for you before it's time for you to leave the hospital. During the first 2 weeks after your surgery, the first rule is, once you leave our facility, you'll go home, you'll get settled at home, and you're to stay inside your home until your 2-week follow-up visit with a surgeon. At that time, he'll tell you what's next. During those first 2 weeks, when you're in the house, we only want you to get up for about 20 minutes at a time. Get up for your meals, get up to go to the bathroom as often as you need to go to the bathroom, and you're allowed to get up once a day to either shower or sponge bathe. And that's really about it. We do want you getting up to sit in a regular chair for your meals. It's a good time to work on that stretching of your knee. So please don't have somebody bringing your breakfast, lunch, or dinner to bed for you. The other times during the day when you're not up for breakfast, lunch, or dinner, to go to the bathroom, or for showering, you should be laying in such a way that your lower leg is elevated above the level of your heart and that knee is as straight as you can get it. In order to elevate your leg, you can either use one of the wedges, which we will have available for your use while in the hospital, and if you decide you'd like to purchase one, we'll make sure that that happens, or you can fashion a bolster or a roll of some kind. Please keep in mind whatever you're making should generally be about 8 inches in diameter in order to make it so that your leg is above the level of your heart when you're laying down flat. When you're laying with your leg up on the wedge or the bolster, you can use your cane as a leg lifter to get that leg in and out of bed. You'll attach the handle of the cane into the arch of your foot. The secret here is to keep your knee locked out straight to give you better lift with your arms. And get it up onto that wedge. When you're positioned on the wedge, you can have your heels off the edge, but your ankles have to be supported. And this is what keeps your knee straight while you're up there. It is very important that you get your knee straight while you're healing. If you do not get your knee straight while you're healing, it will not get straight. And I'm telling you this because it's uncomfortable for most people to have their knee straight during the first few days. So, you'll have your leg up on the wedge, and you'll be laying down flat so that your legs are above the level of your heart. And this is how you'll spend pretty much all the time for the first 2 weeks. We do prefer for somebody to be at home with you so that that person can get your meals to and from the table, your ice to and from the freezer, and to be standing by while you're getting in and out of the shower. Everything else you will be able to take care of on your own. We do expect that you'll be able to get yourself dressed using the equipment, or if you're flexible enough, by doing it on your own. The equipment that you'll be using, we will have available for you to use while you're staying in the hospital. And if you decide that you need it or want it for when you're getting home, we can make sure that you get that before you leave here. The equipment we will have available for use is the reacher. We use this for getting your shoes and socks off, for getting your pants off as well as on, and generally just to pick up anything that's out of reach that you can't bend over for. So I can use this to push my shoes off, and I can also use this to get my socks off. Another handy thing about the reacher is you can use it to get your pants on. When you're getting dressed using the reacher, you're going to want to dress the operated leg first because that leg doesn't move as well. And once you get that leg into the hole, the other leg you can generally wiggle around to get it in there more easily. When I'm using the reacher, I pull the trigger here to get the handle, the end to close. So if I grab the waistband of my pants using my reacher, I can drop it to the floor, get my foot in the hole, and once I can reach it with my hands, pull it the rest of the way up. And like I said, your other leg can just go right in there. We can also use the reacher when you're getting undressed. Once you've lowered your pants to your knee level, you'll sit down and use the reacher the rest of the way to get your pants off. The other equipment you'll use for dressing is the sock aid, which is this. You can use this for socks as well as for your Ted hose. Regardless of what you're putting on, the bottom of the sock or the bottom of the stocking will go at the bottom of the trough. And you want to pull the toe as tight to this opening as you can get it. Smooth the sock up just to these knots. You'll hold one handle in each hand, drop this to the floor, slide your foot into the hole, and then you're going to pull slowly, and as you reach your heel, kind of angle it up the backside of your leg, and that will put the sock on for you. As I said, you can use it the same way for the Ted hose. These are a little trickier to do with the sock aid, but it is possible. If you have somebody at home that can help you, certainly let them help you. But you'll do the exact same thing. You get the hose onto the sock aid, pull the toe part as tight to that opening as you can get it, smooth it out as much as you're able to, drop it to the floor, slide your foot into that hole, and you'll pull slowly, angling it up the back side of your leg as you pull. Generally, once I get it to here, I can pull it the rest of the way up myself. You will be wearing these Ted hose all the time until the doctor tells you otherwise on your operative leg. You will have just an ABD pad that we will put over the incision. And these will be on all the time unless you're in the shower. You will take them off to shower. You'll probably need somebody else to help you take those off. And your incisions will be getting wet and clean when you're in the shower. We recommend that you use a very gentle soap. Here in the hospital, we use the Johnson & Johnson baby soap, and we do give you some of that to go home with. Any gentle soap, Dove, Dial, Ivory, any of those would be fine. What we don't want anything with microbeads, nothing with skin sloughing capabilities, none of those body washes that have a built-in lotion component that, can get into your incision and cause an infection. At night, you will not need to have your leg elevated. So you will not need the wedge or any other bolster that you've designed, but you will need to wear your knee immobilizer at night, all night, every night until the doctor tells you otherwise. This wide part goes at the top of your thigh, this narrow part down at your ankle, and this hard spine goes behind your knee. When you're putting these on, you're just going to take the straps from the bottom going up. It goes one strap from one side, the other to the other side, the entire way up your leg. These are meant to be snug. This is meant to immobilize your knee. However, if you have these so tight that it's pressing into your incision or into your drain site that's often very tender, or if you suddenly can't feel your toes anymore, then it's too tight and you can loosen up a strap or two. Just don't make it so loose that your leg is flopping around in there. When you have these on at nighttime, as I said, you do not need to be elevated, and you are actually allowed to sleep in any position that you want to. So if you're not a person that sleeps on your back, please don't feel that you have to stay on your back. You're allowed to sleep on your side, on your stomach, however you can get comfortable. If you're going to lay on your side, I would recommend that you put a pillow between your legs just for the sake of comfort. You may even want to have a couple pillows tucked behind your back so that you're not rolling out of this position all night long. When you wake up in the morning and you go to remove your knee immobilizer, I would also recommend that as you're taking these straps off, you reattach the straps to the side that they came from, simply so that the next night you're not digging around underneath that leg trying to figure out which strap came from which side. The other thing that you'll need to know about is the ice. You will all go home with at least one ice bag. If you've had one knee done, you get one of these black ice bags. And these hold 3 packs of ice. So when you've had a single joint done, you go home with one black bag and 6 packs of ice. So you can always have 3 on your knee and 3 in the freezer ready to go. When you've had both knees done, you'll go home with 2 black bags and 12 packs of ice. Again, always having ice on your knee. You cannot over ice your knee. It's going to help with your pain control and help with your swelling. And he always says if you're not frostbitten, you haven't overdone it. So please continue to use your ice as long as you can tolerate it. The last thing that we need to cover today is how to get safely in and out of the bathtub shower. You will need something to sit on while you're in the bathtub or the shower, regardless of whether it's a bathtub shower combination like this or just a shower stall. If you have a shower stall, I do not recommend that you sit on a built-in shower seat. Those are generally low and they're generally not very deep this way, and you end up kind of perched at the edge. So I do prefer that you have something separate to sit on for in the bathtub or the shower. There are 2 basic options available out there. This option is what we call a shower bench. It sits both inside and outside of the bathtub shower. The second option is what we call the shower seat, which is this, and this one sits entirely inside the shower. I'm going to show you how to get into the bathtub using both of these options. Please know that neither of these are covered by insurances of any kind. This is an out-of-pocket expense. I would prefer, if you don't already have something, that when you're here we can practice on both so you can see what you like better and we can get you whatever you need. All right. When you're using the bath bench, you'll back right up to that seat, lower yourself down gently, and then you can use the cane as a leg lifter to get your legs up and over the edge of the tub. You'll sit while you're showering, and when you're done, have somebody bring the cane back so you can get your legs back out. Get yourself squared back up on that chair again. While you're still sitting here, you're going to get as dry as you can be. I don't want your arms and hands wet trying to grab a hold of that walker. I don't want the rest of your body wet making puddles on the floor that you can slip and slide in. Get dried off, get your walker, and get yourself back to bed. The other option is the bath seat. This sits entirely inside the bathtub or shower. You'll do exactly the same thing, only in this instance, as I back up to the seat, I don't feel the seat behind me, I feel the bathtub behind me. I need to double check visually that I'm squared up on that seat, reach back, and lower myself down gently. Again, you'll use that cane as a leg lifter to get your leg up and over the edge of the bathtub. And again, you will sit the entire time you're showering. When you're done, get that cane back, get your legs back out of the tub,